Hey guys, it's Dr. Jackson over here at the Sports Pod. Just want to bring you a quick video today. I'd like to talk to you a little bit about Tommy John injuries. So this is something very common in baseball, especially overhead throwing sports such as javelin, football. Also gymnastics is very prevalent as well. So you're probably thinking to yourself, well, what is a Tommy John injury? Well, a Tommy John injury is actually going to be when you have some sort of injury or damage to the inside part of your elbow. So right in through here is going to be the area that's usually affected. Now with Tommy John injuries, it's usually the ulnar collateral ligament. And so essentially that ligament attaches the upper part of your bone, your humerus, to the inner bone on your arm, which is the ulna. And the way you injure this is through just repetitive stress. So any type of overhead throwing motion where the elbow kind of comes forward and puts what we call a valgus stress on here, which is going to gap this joint, that ligament in particular, and then you come down and snap down and through, that's going to cause an injury to that area. It's just over time, repetitive stress of this area, the tissue begins to weaken, you get a little bit of tearing or fraying in that area, and over time, this may manifest as pain. You may also get some irritation, numbness, or tingling onto your forearm, maybe down into your pinky or your ring finger on the affected arm. That's because there's a nerve which passes through there which can get irritated. You may feel like you have a little bit of weakness or instability if you go to throw a ball, a football, baseball, etc., or maybe you're swinging a racket and you just don't have as much power. If it's a complete tear, then also, well, obviously you would get a lot of instability in that area. So you may be wondering to yourselves, well, how do I know if I have a Tommy John injury? The best way to go about determining this is to just see a healthcare practitioner. So whether it's your chiro or your primary care, your PT, go get it checked out. If you're not sure, the best way to actually get a definitive result is actually going to be an MRI. So the MRI will tell you exactly what structures are involved, the extent of that structure. If it's bad enough, then you will need surgery. However, most patients respond very well to physical therapy. And something you may be wondering now is, what if I have a Tommy John injury to my elbow? Am I doomed? Definitely not. So oftentimes players which have Tommy John injuries come back stronger than they were before. This is because they're actually strengthening all of those small structures on the inside of your elbow and making it stronger than it was before. In fact, one of the most famous Hall of Famers in baseball is a pitcher named John Smoltz. He had Tommy John injury. So it just goes to show you, if you have an injury to the inside of your elbow, if it is in fact a Tommy John injury, you can still go on to achieve great things, bigger and better things. So I hope you learned something from this video. If you have any questions, feel free to contact us on social media. That'll be down here in the left-hand corner. Once again, I'm Dr. Jackson from the Sports Pod, and move free.